I All right. Uh, yeah. So after completing my medical student career, then
Yeah,
I
it's
joined
in
the.
the yeah.
Yeah, I think it started recording.
Thank you
Yeah.
so much.
Yeah. So I joined the Wijerathna medical faculty. Then I worked as a post intern doctor in very rural hospital. It's in between Mihintale and Kahatagasthigilia, Tamanna Hospital. Probably most of the students know about it because you're going for appointments there. And then, so I took risk. I resigned from government sector and joined medical faculty. Then I wanted to migrate to Australia. So I take another risk and moved here without any job because my wife got job here. So I moved here. So likewise, if you want to find opportunities in overseas countries, you have to always need to take risk. So yeah, so, and the other thing, so you have to have some uh, background goal or some sort of like something that induce you to go overseas. So for me, what it was like, my mother had friend who always visited from Australia back to Sri Lanka. She's one of good friend of my mother. So when she comes to our like house, always she brings stuff from Australia. So I was passionate about Australia. So then I wanted to move to Australia when I was a very small kid. So I think around when I was in year 6 or 7, I wrote a letter to Australian embassy stating that I want to come to Australia, how to do that. Then actually they sent a book to me. So my father recently sent it back to me. Uh, so they sent that book. It's not coming. So likewise, so you need to have some goal if you want to migrate to some overseas country. So it's depending on person to person, as Eranda said in his lecture. So he had some type of goals, and so you have to have something that uh, gives you like inspiration to move to overseas countries. So at the moment I'm working as a general practitioner in Australia. So I know, because I was in Sri Lanka too, so I know we have different concept about understanding of who is a general practitioner. Especially in Australia, general practitioners are specialists. So like specialist cardiology, specialist respiratory. The general practitioner, being general practitioner is a specialist thing. So we have exams like specialist exams. So at the moment I'm doing like final training of my specialty training, and I'm gonna be specialist general practitioner end of next year. So actually quite the what we thinking as a general practitioner back in Sri Lanka is totally different from what here in Australia. So I will just quickly take you through what I usually do, because this give you clear idea what you're looking for, and it gives you some like morale to be a general practitioner here. Okay, so I usually do see 26, 28 patients per day. So I started work at 8:30 and I finish just around 5 o'clock every day, weekdays. So this is the I'll quickly take you through a few patients that I saw today. So, and you will realize how what general practitioners doing in their practice daily. So I saw a lady today. She's 64-year-old. She got like random blood sugar of 15, and she's on metformin, and she's on another diabetic medication, and her EGFR was 28. So if you see this type of patient back in Sri Lanka, if I see this type of patient, I definitely send her to hospital or endocrinologist. But here, as a general practitioner, you can't do that because you have to manage this. So because endocrinologists, there's only one endocrinologist coming to our area once a month. but waiting time for see him is 5 months. So we have to manage these patients. So I started insulin and stop all the other medications. So, and next time when you go out and take patient in, so this is the patient came. So he got like psoriasis, quite bad psoriasis. So I have to start treatment for this patient because there's no dermatologist in 500 kilometers radius. There's no dermatologist. So we have to start treatment. And so next patient, when you take next patient, this patient comes with this type of lesion. So when you see this type of lesion, we can't miss this. So this is a basal cell carcinoma of the skin. So I have to arrange. So I have to remove this skin cancer because there's no dermatologist. So we'll book him for 2 weeks time to in our procedure clinic. So we're gonna cut this lesion and send it to histology with a clear margin. So yes, so these type of things. So every and each patients are different. So we have to manage all these cases. That's why general practice is a specialty here. Okay. And not only these type of things like STIs. So we have to manage all the STIs. Like if patient present with chlamydia, we have to treat them. Someone present with syphilis, we have to treat them. For example, here there's a lot of people taking pre-exposure HIV prophylaxis. So like especially sex workers and gay people and lesbians. So all these people taking different type of HIV prevention medicine and post-exposure prophylaxis. Likewise, we have to start all these. And as a general practitioner, we also are the key role in um, approving driver's license and approving Medicare, Centrelink. Those are like government subsidiary stuff for people. So we have to approve those different paperworks, and we have to do immunization. We have to advise travel medicine, advise like if someone going to Sri Lanka or other countries. So we have to provide them needed vaccination, needed malaria prophylaxis, those are type of things. So it's quite interesting to work as a general practitioner, but there are risks and but if you know what you're doing properly, it's very interesting and very enjoyable thing. Okay. And so why I am here as a general practitioner and what are the advantages you can get if you being in Australia. I will talk about Australia more because Eranda talk about UK in detail. So if you being a general practitioner, you can have good quality of life. So what do you mean by good quality of life? So good quality of life means, for example, if you want to buy new iPhone 16, so I can buy tomorrow, I can go to shop and buy iPhone 16. But if I were in Sri Lanka, I will think 1,000 times, am I going to buy this? Am I going to buy this? I'm not going to buy it definitely because I have phone. But the quality of life means if you think something, you have to get it, like, and you have to have like nice life balance as well. And like health wise, we don't need to think anything about our health because healthcare system is quite good. And education for kids, you don't not need to think about anything. Other things like politics, we don't go and do politics here as a doctors. So there are people, politicians do their job. So all these things put us good quality of life. So yeah, so and like I usually work in weekdays 8 to 5, and weekends I usually work once every 4 weeks. I do weekend shift, one weekend shift. uh, but so because I'm not working in the weekends, I can travel and I can enjoy time with family, and I can do anything because next thing, if you want to have good yeah, so other main thing, uh, even though people say like we're doing doctor job to enjoy what we're doing, yes, it is but you need to have some income too. So to enjoy life or enjoy what you're doing, if you earn good money, then you can enjoy what you're doing. Otherwise, your brain always clog with other stuff, like if you want to pay loans and stuff, if you think about those things, you can't enjoy what you're doing. So I'll quickly go through what GPs can earn here in Australia. Usually, like medical field, the people who earn less here are like hospital doctors, like SRMOs, registrars, and intern medical officers and resident medical officers. Their income is quite less than in between general practitioners earnings. But in Australia, the highest earning people are surgeons. Like when we take whole Australia, the highest earning people are surgeons, and then the anesthetics, then the other specialties. For example, so I'm usually open person. I have to break all the myths that our graduates and all the most of Sri Lankans have, because when I was back in Sri Lanka, there are a lot of myths, but now I'm here in Australia, I know what's happening. And for example, if you want to practice as a specialist here, it's quite hard to get in. I will tell you how to get in to specialty field next few slides, but I will talk about what they can earn and what GP can earn. So usually, for example, if because the medical center that I'm working is a specialist medical center too, there are specialists coming to there. For example, today we had two cardiologists. Usually they see like 30 patients per day, so they charge around 350 from one patient. So you can calculate and multiply and see how much they earn. Okay. So usually general practitioner, because our clinic is fully private clinic. So there's two different way of billing here. So government funded things are like bulk billing. So government pay whole amount, and there are clinics do additional money, get additional money from patients. So usually the general practitioner cost like 75 or $60 per consult. Okay. So you can calculate and see how much you can earn. But if you move here as a general practitioner or specialist, like income wise is good and quality of life wise is excellent. Okay. And so there are doctors coming here as general practitioners as well as medical officers and JMOs and SRMOs. And I'm talk about the criteria for UK. Actually, criteria for here are quite different. What we discuss, what Eranda discussed for UK is quite different seems. For here, it doesn't matter whether you work in Bush or whether you work in good hospital in Colombo. So, for example, my wife worked got job here as a emergency registrar, but before moving here, she's worked in primary care medical unit in Canada. That's just like remote location, uh, closer to Rambau, just past of our FMS. So it doesn't matter where you work to get a job here in Australia. So don't worry about where you're working if you want to move to Australia. The important thing is what you're writing in your CV is what they want, and your communication skills, what you do in the interview matters a lot. And there are oceans of opportunities here once you moved here. So like general practice, so you can do like, if as a general practitioner, you can do more courses. Like for example, if you happy to do skin stuff, you can do more skin cancer courses and you can do more skin cases. So if you do more learning here, you can earn more. Likewise, like if you want to be a GP obstetrician, so you can do course for obstetric and gynecology and you can be a GP obstetrician. Sometimes there are GP surgeons who do colonoscopy and different things. Like what? Likewise, you can do specialty in subspecialty in GP as well. And yeah, so I'll quickly go through different opportunities that Sri Lankan medical graduates got at the moment. So you can move to Canada. So there are, if you want to move to Canada, you can move to Canada. So just Google MCCA, that's the Canadian Medical Association. Don't, what I suggest, don't listen to anyone who still in Sri Lanka talking about things in other countries, because it's quite different. So because when we when we want to move here, so everybody says like, don't go there, there's no jobs, nobody taking, there's no GP opportunities. Even one of my relative here in Sydney told me that there's no GP opportunities, but I work clinic next to his clinic initially. So don't listen to anyone, just all the information available in online, so you can read about them, and yes, opportunities are there. So if you want to move to Canada, there's two exams called MCC, Medical Council Canada exams, and Eran clearly and extensively discuss about lab and opportunities to move to UK. So I'll more talk about if you want to move to Australia, so how do you do that? So first of all, you need to complete your medical graduate. That's very important, medical graduate thing. And you need to have your internship complete. So some might say no need to complete internship, but it's very hard to find intern opportunity here in Australia, because even Australian graduates trying to get intern opportunities, so they have to apply separately. So if you come here and apply for internship, there's like very minimal chance that you get internship here. And what I suggest was, once you complete your medical graduate, while awaiting for your internship, don't do private practice and don't do bad medicine, because unless you do internship, you don't know what's going on. You don't see patients properly, so actually you can't practice well without doing internship. So you need to do internship, which is needed here in Australia, because you can't do internship here, it's very hard to get in. So you need to complete internship. And what I suggest, so in between internship and completing the medical final exam, you can do sit for AMC1 if you want, because you have fresh knowledge. And again, AMC1 is a quite quite different exam. So for example, so it has like 150 MCQs, and 120 MCQs are marked MCQs, and there are 30 MCQs trial MCQs. But in the exam, last 30 MCQs are like marking MCQs. You must answer those 30 MCQs, and it it check you six different areas. I'll quickly go through them. It divided into medicine, surgery, genomes, pediatrics, mental health, and population health. So major component, like 30% of questions are from medicine and surgery, and 15% from others, and 25% from pediatrics. So for example, if you get like pediatric, like for that 150 MCQs, you get marks out of 500. So if you do first MCQ, if it's a pediatric MCQ, so they divide MCQs for 3 categories: hard, medium, easy. So if you get first question, hard question, if you answer that, next question gonna be hard one. So the candidates sitting next to you get different questions. The candidates sits to your left side get different questions. Depending on your answering capacity, you will get different questions. Like if you answer all hard questions, you get more marks. If you think that exam is easy, then that's the loss. It's because you definitely gonna fail, because you get all, if you always answer easy questions, that means you're not doing the exam well. So after doing AMC1, what you can do, to get job here, you need to do English test, IELTS or OET. I suggest better do OET, because I did both, because when I moved here, I thought of I will find a PhD, but later I thought why I should do that, because uh, yeah, doing medicine here is much better than other things. So before that I did IELTS. So I don't like IELTS because it's not medicine, but OET is what you do usually. To writing, especially you just need to write letter. Suppose speaking, just consult to patients likewise. So it's quite easy. But after doing AMC1 and AMC1 and English test, you can apply for two different things, either hospitals or general practice. To apply general practice, you need to face another exam called PESCI. So it's type of a interview that you give, that they usually give few cases, uh, like 3-4 cases. Those cases gonna be role plays. And for hospitals, they again do interviews. It's more like a PESCI in a different way. So they will do interview, and especially back in Sri Lanka, there are interviews happening from there are interviews conducted by emergency department in Campbelltown. So the director of Campbelltown is a Sri Lankan, Dr. Sellappa. So he comes every year to Sri Lanka to get some doctors to his unit. So that's how we got, my wife got job offer, but she didn't work in Campbelltown Hospital, but different hospital. It depending on how you face the interview. So if you face well, then if they think that you're confident managing a patient, then they will take you definitely. Just you need AMC1 and English. But after coming here, you can do AMC2. Once you do AMC2 and complete 1 year under supervision training here, you can become generally registered doctor here. Then you become fully independent. Otherwise, you have to work with under supervision. And yes, as I said, you need to have MBBS internship definitely, because it's hard to find intern post here. But I suggest do at least 1 or 2 year post intern experience, because I will tell why I'm telling that, because I will show you a copy of CV, because you need to show something. So this is the AMC. You have 3 pathways. One is standard pathway. So if you just pass out as a medical student, uh, especially now Wijerathna is taken as accredited medical college for AMC. I think that's because of Akram, who's in first batch now. He's a geriatrician here. So for AMC, so you need to first do your certificates verified by ECMFG. So there's something called ECMFG. All these details available in Australian Medical Council website. After that, you can register for AMC1, and you can do exam either in Australia or Singapore or India. And then you can do IELTS or OET, or there's another one called PTE. Those are English exams. After doing those 2 things, you can start applying jobs. And it's again depending on the luck and how much jobs you applied. So what we usually did per day, we did like 30 or 40 applications. So you need to find nobody coming to you and give you a job. So you need to find it. How hard you find, then how easy you get the job. Okay. And yeah, there are opportunities. People telling there are no opportunities in Australia. There are opportunities, but depending on how the way you reach them. And there's another pathway called competent authority pathway. There's a way of moving to Australia. So for that, like for example, now Aranda working as a specialist training, specialist training back in UK. So once he completes specialist training there, once he get the full GMC registration, and when he got like 1 year work experience in UK, then he can move to Australia. So that's because he got General Medical Council registration in UK. So there are a few medical councils Australia approved the registration as competent. For example, UK, Canada, USA, New Zealand, Ireland. So those are the main medical councils. Even though it's competent authority pathway here in Australia, if you moved here under competent authority pathway, still you need to work 1 year under supervision with another doctor. If you go for like GP job, then you need to work under supervision, because you will get provisional registration, not the proper one. So once the colleague, that supervision person, signed you as a competent doctor, then only you get the specialist, I mean the general registration. And there's something called specialist pathway. For example, now imagine you complete your SR period in cardiology, so you want to move here in Australia. So the coming here as a trainee doesn't mean that you're working as a specialist. So when you come here as a, like, like once you complete SR period, you come here as a training. So it's not the specialist training you get here, you just come here as work as a senior registrar or registrar. So that doesn't mean you get specialist pathway, but you come under specialist pathway, but you won't get the specialist registration here. So to get the specialist registration, you have to complete 1 year here, then go back to Sri Lanka and get the board certification. And I think there's a thing that you need to do in Sri Lanka to get the proper board certification. I think you need to work back in Sri Lanka for 1 year. So once you get the proper board certification, then you eligible to apply for, like, imagine, for example, if you want to be a cardiologist here, then you need to apply for jobs here. Then what happens is, if you get a job here, so then you need to get verification from College of Cardiologists. So what they do is, once you get the job, you need to face interview. So there will be like 5 or 6 cardiologists there in your interview. So they interview you as a cardiologist. Like, imagine now you're working as a cardiologist in Sri Lanka, so you want to move here. So the college interview you, and there will be a few doctors, and if they think that you confident, then they will give you a position here, but still you need to work under supervision of 2 cardiologists for 1 year. So if they happy and sign you as a doctor specialist here, then only you can work here. So that's the specialist pathway. So once you become cardiologist, the income wise and other things are quite good, and so no need to think about twice to do things. And yeah, there are a lot of specialists here in Australia from Sri Lanka. Especially, I'm working in an area called Dubbo. It's taken as rural for doctors, but it's not rural. It's a developed area here, but it's far away from Sydney. I used to work in Sydney, but this place is 500 kilometers away from Sydney. But we have like 8 or 9 specialists here, especially like Dr. Chandika, he's a specialist surgeon, and Dr. Sirisena, you might know Dr. Tilak Sirisena, he's the main cardiologist in hospital here. And there's a gynecologist, he's the main gynecologist here. So many Sri Lankans working here as specialists. So or just only you need to do is just don't give up and don't listen to anyone telling anything, especially in Sri Lanka. And just Google, and everything is in online, or yeah, just listen to someone telling the truth. And there are a few myths associated if you want to migrate to Australia. Like many think they need to do AMC2 to get job. That's wrong. Even if AMC1 and English, you can get jobs. And other myth is there's no jobs in Australia for Sri Lankan doctors. That's another myth. So there are opportunities unless you look for them. Nobody come to your home and knock the door and give you a job. You need to find it. And there's another myth. Yeah, so other problem is people think people here are always try to put legal cases because of your negligence. Anyway, if you work in Sri Lanka or any place, doctors are like someone with a knife, because if you do wrong thing, someone can die. So you have to be responsible here. Again, if you do the correct thing, there's no issue at all. So, but there are, even if you're worrying about legal issues, there are like, I have like, we all have insurance, medical defense insurance, and we do have lawyers. So if someone make complaint, what we just need to do is, if you think that you're correct, just call your lawyer. They will sort out the issue. Likewise, so no need to worry about those things, and uh, defend from your missions. And other thing is, most of doctors think that they need English test to AMC1, which is wrong. That's true for PLAB, but not for AMC. You don't need English test to do AMC1. Actually, you need English test for medical board registration. And sometimes some pesky providers ask AMC English test, but to get medical board registration, you need to have English test, but otherwise not for the AMC1 or AMC2. All right. So because we want to migrate to Australia, so nobody help us, not even our relatives here, not even doctors here. So I was frustrated, and when I was here, I know that there are opportunities. So, and because of doctors, I think Professor Agampodi telling our students to contact me, are usually getting like 2 or 3 messages every week asking about how to come to Australia. So because I'm getting too many messages, so I thought of creating group for Sri Lankan doctors. So we created a group here, so you can join in and make sure that doctors are in here, because we sharing like private details. And I was able to put a lot of hospital doctors, general practitioners who want general practices and wanted to recruit Sri Lankan doctors and who don't know how to find them. So all post and uh, exam related, how to register for AMC, everything will be there in this group. So even though I might not able to reply, but there are few doctors, admins, and moderators in the group, and they will always happy to help. So all the doctors who happy to help are in this group, and I'm adding more specialists and more GPs in future. So this is only to help you guys. And when I created this group again, because Sri Lankan doctors sometimes see things differently, which you should not do. Because if you come here to Australia, you have to think like someone in Australia, not behave. Even if you go to like UK, you have to behave like UK person, not someone else, which makes it hard to work. So that not that doesn't mean that forgetting everything in Sri Lanka, but when you work, especially, you have to be like, if you want to work as a GP here, you have to be Australian. If you be more Australian, the more people will like you. And yeah, so that, and then more you enjoy what you're doing. And yes, I'm happy to answer any questions. If you can open your mic and answer, ask questions, I'm happy to answer. Any questions? And I quickly go through, okay, I'll quickly go through that as well and show you what you have to write in your CV. So I saw several CVs from some of colleagues and students. So they put like things that they did in the school, which totally crap. So don't put those stuff in your CV if you want to work in overseas country, because nobody cares what you did in the school, whether you play soccer or whatever the things you did whether you head prefect or whatever the thing, nobody cares. because everyone knows now you're a medical graduate because you passed the A levels and O levels. So no need to put those crap in your CV. So main things you need to do your date of birth, whether you're male or female, your address, phone number, contact details are must, and then your qualifications. And then because I'm working here, so this is my CV for this new job. So I have registration because that time I'm working under supervision, so I put that as well. So, and especially here you need to have CPD, you need to have life support course done every 3 years, advanced life support, so you have to do those things. And then you have to mention about your position, and you have to write every and each single thing you do at your work. So that's how you show them what you're capable of. Not like just don't put this stuff only, you have to show them what are your skills. So if you send something like this, then this CV will like comes more prominent uh, from other CVs. So you have to mention what you're doing. And so I did observership in emergency department here in Australia as well initial time, so that gives me good opportunities for learn things. And I put these are things I did in put what I did as in Sri Lanka. So you have to do everything, like you have to put everything what you're doing. So minor things matters, like putting a cannula is it's a significant thing here, because you have to do the cannulation if you work in the emergency department. Like uh, any minor things you have to do, nurses won't do anything. And so this is, I used to work in a rural hospital. You see, I put like outpatient department, what I have done there. So emergencies I manage because I was the only single medical officer there. So I manage all the emergency, which is very important here. So, and clinics, antenatal clinics, well woman clinics, well baby clinics, all the things you can mention. Just take time and think about things and write it down. And so you see that's a lot of things there in the CV. That's how your CV point out from others, and then you can easily get job. So these are my internship details. And yeah, and you have to specially mention what are your skills and what did you observe. So those are very important when you after a job in different country. And you have to mention about your English test. And other thing I'm gonna mention is reference. So these two doctors are my colleagues in back in other medical center in Sydney. So yeah, so when you put referees in your CV, make sure that you put someone that you trust, who gonna give you good comment about you, because especially if you're going to hospital jobs here, they will definitely send like feedback form for referees, and depending on the referee's report, they decide whether they taking you or not. And don't put like referees for the O-level teachers or A-level teachers, or someone like if you're working in the like now you're working in respiratory unit. Imagine now you're working post intern respiratory department. Don't put intern supervisor there, because sometimes they might not remember you, so they might not give good comment. So put someone recently that you have contact with and trusted person who gonna give you good comment. And then you can put a little bit about your publication and stuff. But for job here, they don't much care about this stuff, only if you apply for university job this matters. And I just put that because I got some research. Another thing I want to mention here, I did back in university, I did MPhil and MPH. Actually, those two courses doesn't matter at all here for my jobs, but I again learn a lot from those. But I'm telling you, don't if you want to do something, like if you want to migrate here, don't waste your time doing those things. But it's not waste for me, but I learn a lot, and I like doing research, and I'm doing it at the moment as well. That's a different passion for me, but not for, it's not not matters, I mean, not matching everyone. Okay. But you can do like, once I moved here, I did Sydney Children Health Program. These ones are very 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 good for general practitioners. So because if you put this, you can see a lot of kids and you know what you're doing. Yeah, likewise. So yeah, that's about CV. So if you have any questions, just ask. I might able to answer anything.
Sir, excuse me.
Yeah.
Sir, if you are migrating to Australia without doing AMC, is it the same pathway we have to follow after migrating to Australia
You mean
to get
after
the
doing
AMC?
internship?
Yeah.
So what happens is, if you move here without doing AMC, you have to, because if you want to study for AMC, you need to have at least 3 months, minimum 3 months, because the AMC exam is quite different. So you need to know everything. So because I know what we teaching in the medical college, and I know what we learn in the medical college, that stuff is quite different from what the AMC Medical Council wants. So you need to study in a different way. So you need to have like 3 months for that, then the exam, then so it totally take at least 8 months. So that gives you gap. So when you are going to apply for medical registration, then the board asks why you have this much of gap here. So what I suggest, if you want to migrate, just do the exam first. There are some doctors who migrate because of their husbands and partners get jobs or permanent residency here. So they do exams here, and the problem is they develop a gap because they are here for a few years. But there are ways that you can break the gap, like going back to Sri Lanka and work there for 4 weeks. So that breaks gap. So that's why I'm telling you. So we put everything here. If you have any questions, you can ask, then ask here in this group during that process, then we can answer. Any other questions? I'll quickly go through the chat. Oh yeah, what's the IELTS band record for doctors to work in Australia? So it's 7 for each component. For OET is B for each component. For this group is private group, so only I can add the doctors to that group. So yeah, I might quickly do link to this chat. So I think only 20 of you can join. Yeah, any other questions? All right, so then I'll leave the meeting, and thank you very much, Parami, for inviting me for this, and thank you, Anjanaya.
Okay, Buddhika, thank you so much. I think Parami is disconnected. I think
Okay.
they're having a power failure. So nice to see you again and
Yeah,
hear your voice.
yeah, same here.
Uh, and yes, thank you so much. I think students may be having a lot of questions, although they are not asking at this moment. So you might get,
Yeah,
you might, they might want you to add themselves to your group.
yeah.
So hopefully they will get benefit. So I think you are enjoying Dubbo these days.
Yes, of course.